And we're live. Welcome back, everybody, to the next episode of Business Emergency Room. We're incredibly fortunate today to have Dr. Mara Windsor here. Full disclosure, she also happens to be, besides amazing accolades of a doctor and running a nonprofit, all these wonderful things, she also happens to be the wife of my partner, a dentist, Neil Reithinger. So doesn't mean we're going to go easy on her on this interviews, but it's all that up front. Just I think as a finance guy, I'm a big believer of disclosures in the footnotes, but here we're making it even better. So Mart, thank you so much. Eric is, you can see him over here. I don't like him being a mystery because he's the man behind the scenes, our COO, GC, and master of everything BER operations related. So put up here for occasionally he'll pop in. He's got a beautiful background there. It's probably real. He does very well out of Ventus, I should say. So that's probably one of his main apartments. But Eric, you want to give a little bit of Mara's background here, just because it is incredibly impressive. We're super fortunate to have you. And then Mara, you and I'll kick it off.
So, I won't go through the entire curriculum vitalis because we'll be here all day, and it's very impressive. So Neil, good job, by the way. Very good job. So first of all, Dr. Windsor is, emergency medical specialist. She basically runs her group. She is a professor. We won't say where. She's from Arizona. You can, if you want to go do Google searching and stalk, that's entirely up to you. But, we're very lucky that she's, come here today to help us, to guide us in any way she can, to really provide perspective on, what's next. And so, Aaron, I kick that back to you, to really, lead us down that path. And Dr. Windsor, sure. Thank you so much for joining us today.
Thank you for having me.
Oh, our pleasure. So the first thing that I was asked when I was in a couple of finance leadership sessions, and people saying, so people are going to start coming back to work. What guidance could people give? And folks said, well, why not just look to the hospitals, especially at the ER, because they've had to run through pandemic, through everything, nonstop. They've probably got the best, besides the fact that they're medical professionals, so they know what they're doing from that perspective, they've got the best logistics. They've worked this all out. Doesn't matter how perfect or imperfect it is, they're doing it now. And so that sparked our conversation about bringing you on. Housekeeping, I'll tell to everybody else, is that due to Mara's role, we will not be referencing various different places and stuff to keep, granted you could look this all up, but she's speaking on behalf of herself. She's not speaking on behalf of doctors in the world. She's not speaking on behalf of the institution that she's involved in. So we'll be careful with, just some of those specifics, but she's a wealth of knowledge, start that off. So I will say, Mara, welcome aboard. So happy to have you. I will kick it off with, some real basic questions. Is that so pandemic hits, and we'll be asking everybody this. What are the initial thoughts that go through your head when it starts to hit? Granted, you're a medical professional, so you would see things differently, but from a operations business professional, pandemic hits, what happens with you and your organization? What are the thoughts? And then how do you immediately react? I just kind of want to set the stage for that first.
Well, I think in any organization, probably the first reaction is a little bit of fear, right? And I know we saw that in the emergency department, but also fear of mainly, are we prepared? What are we going to do to handle this situation? How do we protect ourselves? How do we protect our customers, which patients are now considered customers these days? So how do we protect everyone? And do we have the proper equipment? Do we have resources set up to allow for the surge? And that was the biggest fear I think that we had, is we weren't prepared for the surge. And that's also why we had to go to social distancing and a total shutdown of the economy, basically, to allow some time. There's great value in time, especially in situations like this where there's a lot of uncertainty and unknowns. And it really bought us some time to kind of look at other countries, what they were doing, kind of look at other states, even in the US, and what they were experiencing. We've learned, unfortunately, a lot from New York and New Jersey. So really it was, the first thought was really to sit back and say, are we prepared? And if not, how do we get prepared? And I think that's where we can learn from a lot of other countries and states as well for the future. And unfortunately, pandemics have been here. History does repeat itself. This will likely happen again with something else, whether it's a virus or some other, you know, catastrophic event. So we do really, as a healthcare system, we need to be prepared. And now we realize the businesses, whether you're a small business or a large corporation, you have to be prepared as well.
So on that, so if you're comfortable sharing, what are one of the two of the things that you would learn from observation of either, you know, my hometown of Jersey or New York, or what's going on overseas, and how other people have had? What were the couple of learnings you were able to take and apply pretty quickly?
Well, I think for our hospital system, it was really about changing the way, it's almost, you know, changing the way you think and perceive the world as you know it, whether you're talking about the healthcare system or the business world. We really had to think outside of the box. It really required our leadership team to start thinking about different staffing models. And, you know, for example, we cut down a lot of our shifts, and instead of doing 12 or 10-hour shifts, we were doing 6 or 8-hour shifts. And then we have surge call in terms of nurses on backup for surge call, physicians on backup for surge call, recognizing that, you know, they may not get called in at all. And I think what's happened, and I'm sure in the business world it's the same, everybody pretty much is working less. There are some businesses that have, you know, more capacity right now and a greater need and demand. But throughout the world, a lot of people had to cut back on hours. A lot of people were losing income, and really trying to spread the wealth, if you will, to all of the employees so we could keep people employed and we can keep people getting paid. But also, you don't, you know, a lot of cities were furloughing doctors and nurses. But what happens when the surge does come, and what happens when it peaks again if you furloughed all your doctors and nurses? So I think from a business point of view, it's similar in terms of your employees. If you are letting too many of them go because you can't afford them, what are you going to do when the demand does come back? And so allowing that flexibility and adaptability to know that this is temporary. So yes, we have to plan for the temporary current crisis situation, but then we also have to plan for the future and what that's going to look like, and what are we going to do when the demand does come back.
So we'll get definitely want to talk all about that side of things, especially your thoughts on like people coming back. One thing I'll say, like in this, how do you keep your team calm? Because as an outside observer, all I can think about is, my God, hospital, ground zero of everything that's going on. And you've got people, like, all I can think about, I don't know, try politics, hazard pay. Like, I am now in ground zero. It's like, I live in a leafy suburb. I can be in my house. I can work from home. I'm not exposed every single day to the disease elements that you guys are, even now more so with a pandemic. So how do you keep the emotional side of things for people, and how do you take care of them in that perspective?
Well, you know, it's when I do a mentorship and education with residents, I tell them, if you go to a good residency program, you will be trained and you will be prepared for this. And of course, there's, you know, a lot of information out there about the pandemic. None of us were entirely prepared for it, so we can't say that, you know, we were expecting this. You know, there are some people out there saying that we're trained for this, and this is, and we are, you know, we are trained for it. We did not expect this. However, I think that if you have the support from your hospital system or your corporation like we did, where you know that you have the proper PPE, we have been covered. I've never had a day where I didn't have proper PPE. Thank goodness. I know that in some cities and countries it wasn't always that way during the surge, but that's also why we did the social distancing and shut
Sure.
them down, so that we could slow that, so that we weren't seeing the full capacity of what could have been. But I think knowing that you're covered, knowing that you have that training, many of us just, it's almost like there's a switch that goes off. We just get in work mode and we do. And it's not, we don't really think about it until afterwards. So afterwards, it's really more about supporting our staff, having debriefings, talking through the different cases and what happened and what we thought. And especially I've noticed that with the nurses, is really sitting down and talking about each individual case and letting them share their feelings and thoughts about it, so that, you know, they're not keeping them internally and dealing with PTSD later down the road.
So quick question, just on definition, PPE. So in the finance terms, that's property, plant, and equipment, which I'm assuming you're not talking about. So I was like, wow, this has gone to
Like,
like gap
whoa, this is going here.
fundamentals. This is exciting for me. I know this. What's the hospital term? What does that mean?
Personal protective equipment,
Wow, I
which
got that wrong.
your masks, your N95s, your surgical caps. Initially there was this shortage in N95s. And I think where I saw our morale decrease the most is when fear hit and we thought that we weren't going to be protected. We are prepared to do our jobs. We are prepared to deal with these life and death situations. But if we're not going to be properly protected, then that's where the fear comes in, and it gets frightening, because not only do we have to worry about ourselves, but taking it home to our families.
Of course. What were cases where you were really surprised? Either that granted, no one expects anything. It's just like, it's the old Monty Python saying, no one expects a Spanish Inquisition. That really aged me right there. But but what were a couple of surprises? You can share. I prefer good surprises, because I try to keep a message of hope, but you can also see something like, wow, like this really surprised. We didn't realize. Like, one thing that I heard was that hospitals had their mask stores. They never really, not all hospitals inspected them. So the elastic band behind the masks were like rotted. So the mask worked, but they had no way to put it on because and no one had really thought about that. Like, oh, I just set it and forget it. I've had this store for like 5 years. I've never looked into it. I never thought, because no one really thinks about rubber breaking.
Right.
So I'm just curious, like, what did you hit that was kind of surprised, both if you want to share like a one that you had to overcome, and then like a message of hope of like a surprise that really like heartened you.
Well, a lot of things. I mean, I think our hospital system, kind of globally, we weren't prepared for this. And I think our hospital system, I wasn't involved in looking at the stock and the supplies to see, but I know that through stories that they didn't realize how underprepared and stocked that they were on these PPE supplies. And even looking through, maybe they thought they had boxes of N95s, but then they were expired, or the plastic, the elastic was no good, so you really couldn't use that. Or maybe you didn't have, the majority, a lot of nurses and females, wear the small N95s, and maybe you didn't have enough of those. You had the larger ones, but it doesn't help you if you can't get the seal. There were things like that I think, have learned we need to be prepared on. And then, it's sad to see that some people take advantage of the situation, and there are all these companies trying to sell you N95s that aren't real N95s, and trying to sell you equipment that isn't really going to benefit you. And then initially too, seeing the recommendations of you need an N95 with every patient, and seeing how the recommendations had to change, because the reality was we didn't have the supplies to keep up with what we thought the recommendations should be. So again, that's where this flexibility comes in, where you have to realize this is a situation we're dealing with. And we've had to, this surprised me, I never thought I would see this in a million years, but we had to actually label our N95s and put them in a paper bag, and they would store them. And then every night they would try to sterilize them and bring them back. So some of the nurses were using the same N95s for 4 to 5 days. And we're told that you can get 5, uses out of it. Obviously, if you had a patient that had COVID-19 and was really contaminated, then they'd recommend throwing it out. But really having to be mindful and conscientious of the supplies. In America, we normally don't have to worry about that.
Yeah.
So that was a big surprise for all of us, but in a positive way, because it really allowed us to think differently about our utilization, and how, these supplies are what's going to save us. They are going to protect us, and they're going to allow us to keep taking care of people. With that, the most positive thing that I've seen, I know in our community, in terms of our kids' school community, the community where we live, and then my hospital community, is humanity. People have come back together again. It's almost as if I've seen people just put down their armor and just say, we're in this together. Let's do this. And I have a great example of that in the emergency department. When I talk about staffing models, I also wanted to talk about having flexibility in terms of your job description. I mean, we've gotten to a point where nurses are having doctors administer meds because we only have one nurse and we don't have enough nurses. And then when EMS and the firefighters are bringing in patients who are coding and actively dying, they're staying in the hospital room and working the codes with us because they don't want nurses to have to use an N95 and waste any PPE. They already have it. They've already been exposed. They've already been doing CPR on the patient. So they stay with us, which we never had that before. Usually they would come, give us a report, drop the patient off and leave and go to their next call. But they would actually stay with us all the way through, which is so helpful. And it just reminds me of it is times like this when collectively we can come together to support each other. And I think that's a good thing for society.
I agree. I'm an optimist by nature. I'm a big believer of hope. I've been so, as I say, cyber for me, I've been so impressed with everybody. I've been impressed with, the families and the flexibility. I've been impressed with my neighbors. I've had a couple of neighbors that have told, our online communities and saying, because it's hard to like physical community, say, listen, I've been exposed. I'm willing to go into a grocery store to pick up what you need because I've been given a clean bill of health. Now, I'm not asking for a medical judgment here of whether that's right or right, but there's the humanity of that and saying, listen, says like, I'll deliver for a senior, I'll deliver for somebody and make sure that they're not as exposed. I've been impressed with the ingenuity of all of America, of alcohol distilleries, suddenly making hand sanitizer and doing whatever it takes. I was like, wow, this is America. This is humanity.
Exactly.
So I would ask, so you made something interesting. So people have had to change and actually found a lot of positive ways that, improvements that you made. What improvements do you think, at least facing now, I'm not asking for a policy question here, but what improvements have you, or interesting things you mentioned that you hope to see continue afterwards?
That's a great question. Obviously the flexibility in our staff and knowing we have actually done very similar things that you talk about your community where the younger, healthier physicians have been able to say, I'll be on the front line. I'll go in the COVID zones, what we call them, and I'll go see those patients. And they've allowed our elder population of physicians kind of sit back and just take care of, the broken ankles and, the heart attacks or strokes. So for me, that has been a very positive change that I could foresee us keeping. And similar with nurses. I think also changing the mindset of the way that we think of our supplies and materials. And another good example is prior to this, emergency departments were full. I mean, we just could not really keep up with our volume. And we all know people use emergency departments for primary care. I do think that there was a lot of that. And then our volumes just plummeted. And because everyone was afraid to come, everyone was doing their part, staying home, allowing the emergency departments to really be for these sick COVID patients and true emergencies. Well, unfortunately, that did hurt our economy as well because our ED volumes went down by 50%, and they're still not back up. They're on the rise. But now what we're seeing are critical patients. We're actually seeing very critical patients who probably waited too long to come to the emergency department. And now they've completed their strokes and their heart attacks. And now they're requiring critical care. So our volumes aren't up, but the level of care and the acuity of care is higher. So it'll be interesting to see how that transitions out. Maybe as a society, we have a greater respect and understanding for what an emergency department really is for and what a hospital system really is for. So it'll be interesting to see how that pans out. I do think from, a staffing model, I think we will always probably have a surge backup, and we will always have these calls where, sometimes we're on call and we get called in and we don't. We have to have that flexibility. I know our group does what we call dynamic staffing, and we have some predictive analytics where we're actually able to look at every day's volume. And we used to be able to track, which is just an amazing thought. We always joke that this happened, but we were actually able to prove that as the city buses dropped off near the hospital, our volumes would peak and spike. And we were able to find these predictions and these associations with ED volumes. So it'll be interesting. I think that many groups now will have to transition over to a similar staffing model, and that will probably be a permanent change for emergency medicine.
So it's interesting. One of the groups that we work with does a lot of traffic pattern studies and works with governments and tries to figure out. So actually, I'll have to introduce you guys later because they do. It's fascinating. Like they'll say like, hey, based off this traffic pattern and they get data from like all different sources. There's odds of there being an accident on this road because we have so many cars in X. So they'll make sure that emergency prep is in the vicinity. It also helps with urban planning. You start thinking, wow, you know, if I have a road designed as X or a panhandle designed as Y, or more likely there's more accidents here. So how do I fix that? So that's great. So that's on my to-do list. So now just remind me if I don't. Okay. So question at hand.
Okay.
Regular business, thinking about coming back to work. What are the practical, I'm not asking you for like a medical diagnosis. This is full disclosure here. This is just common tips and tricks. This is Mara Windsor, not Dr. Mara Windsor telling us, because I have to put those caveats there. What do you recommend the things to think about? What do you recommend, not only just from pure logistics and some smart tips and tricks, but also from the human perspective? How do you calm people and make sure that they're going to do okay coming through?
I know that's difficult. I've been actually working with my nonprofit organization, trying to develop a crisis care team for emotional support, because I think there's going to be a lot of that. And I've actually seen recently in the last week during my shifts in the emergency department, people coming in because they just have so much anxiety. And their anxiety level is so high, and then all of a sudden they get this chest pain, and then what do you think that's going to do right now? And you know, you think you have COVID, you think you're having a heart attack. So they're coming in, and I'm actually in the emergency department. I'm having to talk to people about, you know, slowing your breath and breathing, and I'm showing them apps that they can do, calm apps, and you know, they're free, all these meditation apps, all these mindfulness apps. I'm really having to have conversations about that with people, because as an emergency medicine physician, I don't prescribe anti-anxiety medicine or anti-depression medicine. I will not do it. The reality is anti-anxiety medicine that I would give you is just a Band-Aid. So I always tell them you need to find other ways. So I personally am choosing to offer other modalities in which people can calm and soothe themselves and handle the stress and the chaos in the world. So I will share that with them and I will educate them. I think that, again, from a healthcare provider point of view, if I am an employee of a business, I need to know that I am protected and I am covered from my organization, from my boss, and know that I'm supported. And so I think that provides a certain level of calm and a certain level of security. But the reality is we all have to find a practice that works for us, because I really think that, you know, we were already in this state of the world with so many, you know, so much technology, everything moving at such a fast pace. I mean, look at the speed of how everything was, and it just warped down almost to zero. I mean, it's so difficult for me to comprehend how we went from running around 150 miles an hour now down to zero. But I think that this is another positive spin. I think it's going to allow our society to almost get an attitude adjustment, if you will, to realize that less is more sometimes, and staying home, doing less. It allows you to rethink your priorities and what really matters, and maybe you prioritize spending time with the people you really love and care about. And I think in doing that, you can instill some calm and peace with people. But I think individuals have to work at it. It's a practice, and corporations have to work at telling their employees, we see you, we're here for you, we are here to protect you and to support you. You know, one of the recommendations on how to protect your your staff and your employees that I know the CDC is recommending as well, but anyone who can work from home, let them work from home and stay at home so they have less contact. I mean, think of what we're doing to our pollution by not having all these people use mass transit here to get to their office. And I mean, there was a lot of good trickling out of this if we really think about it. And it gives us opportunity to rethink the world that we live in, rethink our business models, and rethink what we want to adapt and carry on in the future.
So on the concept of hope, because you hit it really well, and you a couple of things. As a company, what should I do? I'm completely on board. Like, I want to make sure my employees are protected. I want to make sure my customers are protected. What are some easy things I can do? You mentioned like listening. You mentioned like listening. We're going to give you a forum in which you can speak. You mentioned if you can work from home, definitely do work from home.
Mm-hmm.
But what else can we do? Because those are kind of like people are thinking, like those are kind of like the, I would say like that's on top of everyone's mind. But what are the other logistical things you can do? Because I'm thinking about sometimes you do need to come in and there is a desk or there is a place that you have to go, or you have to go on the site to a client. How do you help? Like what should so how do I as an employer protect my employees and protect my customers?
Well, first of all, I do have to recommend the CDC guidelines, which you can find on cdc.gov. So you can go there and they list it out for school systems and work. And I'm actually going to be involved in our team at my children's school in terms of how do we bring the kids back safely as well. But obviously, distancing as best you can, sanitizing. Neil and I laughed about it, but it was so funny to me when everyone ran out to buy toilet paper, hand sanitizer, bleach wipes. And I thought, were we not wiping our butts before? And were we not cleaning our surfaces? What is going on? Why are we all of a sudden worried about this? And it's funny. I mean, I know they have to do it for the CDC guidelines, but when you go to restaurants and they have to now have a sign on the table telling you they cleaned it, I mean, I am seeing people clean surfaces that I've never seen before in my favorite restaurants. And all of a sudden I'm thinking, wow, we're just now doing that. So that's great. These are things that we can continue to do. And this should be our new practice. And I unfortunately had to take a pandemic to get people to realize that this is proper hygiene. This is what we probably should have been doing before. So definitely hygiene, wearing a mask. And the interesting thing about wearing a mask, I as a physician, laugh sometimes when I see people wearing them because they're wearing them improperly. And so, yes, there may be some places that tell you have to wear a mask, but it really does no good if people are wearing them improperly. Gloves are worthless. All you're doing is contaminating every other surface. And yeah, maybe you're protecting your hands, but you're still doing the same thing. And some people, I think, don't quite grasp that concept. So I'll see them with their gloves on their phone, and then I'll see them eating with their gloves. And I'm thinking, those germs are being carried forward. So I think really having this new understanding of how germs do spread, with that in mind, germs are good for us. So we do need a certain level, and being an extremist, unless you have an immunocompromised situation, is probably not the best recommendation. But the reason why the CDC recommends the mask is, yes, it does offer you some protection, and if you cough or sneeze, it prevents it from being spread out into the air. But also, and I'm guilty of this a lot, and I didn't realize it until this pandemic, and I was having to change the way I move and my mannerisms at work. Most of us touch our face almost 1,000, I think it's 1,000 to 1,500 times a day, and don't even realize it. So the mask does allow you, even if you are touching your face, you're touching the mask. But the problem is really trying to sit and think about these things. Some people are wearing the same mask every day when they go to work, and they're not washing it. So, then all of those germs are still on there, and you touch a surface. I mean, we're still touching and we're still touching surfaces. So I do like the idea of cleaning all the surfaces. I've always, despite what I do, emergency medicine, I've always been a very big germaphobe, and I'm the kind of person, I come in and I get a bleach wipe and I wipe all the surfaces, my phone, the mouse, my computer at the hospital, the desk, everything down when I start, because I want a clean slate. And I've always washed my hands before and after patients. But believe it or not, a lot of people don't do that. I mean, now in the pandemic, everyone's very mindful. So these are the things that I think will save us. And at work, same thing. And now I'm trying to teach my kids too. You need to wash your hands. You need to wash your hands before. Our parents used to teach us to wash our hands before dinner. My kids, I've tried very hard. They don't do that. Now they come home. I'm like, everyone's in the bathroom. Wash your hands as soon as you get home because you don't know what you're carrying on. So I think just making this a practice that we almost don't think of, our self-hygiene, personal hygiene, and business hygiene is probably the best thing you can do. And the reality is washing your hands is the best thing you can do and trying to not touch your face. And if you're working in a restaurant, I think it's good that they're wearing masks. And, the reality is maybe they should have been doing that a long time ago, or at least during influenza season.
Yeah. So 2 questions on that. So, and this is, I know we can go to the CDC, but odds are, Neil's kind of ridiculous. You got to live with him more than me.
I know, trust me.
And trust me, I live with him a lot. I always say, it's like, I got my family and then I got Neil. It's like, he's a brother I never had. What, and I know I could go to CDC, like, what are like some mask tips you would recommend? And I know this is kind of like off topic, but you mentioned it. I just want to get it out there. I have no idea. I do whatever my wife tells me to do. Either it's the made up mask with the bandana and the clips. I'm just like, I don't really know if this is effective, but it makes people happy. I feel like a cowboy.
I know, right?
And then, or it's like I had a whole bunch of masks because I was doing woodwork years ago. So those are great. They're around. And then I got like some disposable masks. And so what are like two or three tips max? Because we can go on today that from mask usage that people should be aware of.
Well, number one, N95 masks should be reserved for healthcare professionals who are taking care of sick patients, because those are the highest level of protection, and people at the grocery store do not need those masks. Plus they're expensive. Plus there are a lot of companies out there that say that's what they're delivering and they're not adequate material. So that's the biggest one that I've seen. And then the reality is pretty much anything that's going to cover from the bridge of your nose and come up, down, so up to your ears and then down to your chin. That covers your nose, your mouth, that covers if you cough, if you sneeze, that protects those areas. What doesn't cover, obviously, are your eyes. Wearing glasses, I think that's appropriate, or goggles.
Yes!
I know.
Yes!
I always wear my glasses at work for this reason. I've done this for so many years. But actually at work, I have a face shield too that we wear. But the general population and general public doesn't need to wear face shields. And goggles, it's interesting because the CDC is actually sitting with this right now and deciding whether or not they want to make people wear goggles or face shields. Yes, it's an area of vulnerability and exposure. But again, it takes somebody sneezing on you or spitting on you for those droplets to really get in your eyes. I know, and it sounds disgusting. So obviously, when are we really exposed at that level in the general public? It would depend on, obviously, your profession and what you do. I went to the dentist the other day. They don't make me wear a mask, and they're sitting in my face. They were wearing goggles, and they had a regular surgical mask. I love the regular surgical mask because they have, a metal little bridge here, so you can actually mold it to your face, and that's more ideal and better. But again, having your face covered is going to prevent you from touching surfaces, touching your face, and touching surfaces. And that's how we transmit many germs.
Do you think, I'm just curious, do you think that from the future planning perspective, I'm just curious because I'm going to ask you 2 questions on the future. One is just, this is kind of simple. If people keep up their hygiene, right? Mm-hmm. So now we've got better hygiene kind of drilled into us. What do you think, just from a health perspective, that translates into the future? Do you think like less chances of cold being spread, less chances of flu, all influenza and everything else? Or I'm just curious, or just I'm just curious, you see like a uptick of people just being regularly healthier because they're not catching things and distributing things that they used to?
That's an interesting question. I guess it depends on how you define healthy, because the reality is our immune system, the best way to explain our immune system is like the type A personality that just wants to work, 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 and it needs something to do. If we don't give it germs, we don't give it something to do. And that's when your body starts attacking itself. And that's when you start to develop some autoimmune illnesses. So our body needs work. It needs germs. We do need a certain level of exposure. For example, obviously we don't really know yet, but there's a lot of emergency medicine research and literature out there and discussions that say probably the reason why children aren't being hit so hard with coronavirus is because they were exposed to 3 different coronaviruses last fall, and they have some exposure. It's similar to the influenza vaccine. Yes, it doesn't cover you for all strands and mutations of influenza, but it covers you for the 2 to 3, sometimes 4 most popular mutations and strains from the previous winter season, so that it offers you some immunity. And if you get the vaccine, yes, you can still get influenza, but chances are you will not get it as bad as you would if you didn't have that. So we do need to have some germs. We do need to have some exposure. I think that for the future, really what it's going to look like is as people start to come back out into society and start to do things and get a little bit more relaxed with social distancing, the cases of coronavirus are going to increase. And then we're going to start to see a surge, and then we're going to have to go back to social distancing, and then we're going to see an increase. And it's going to be, I think, a fluctuation of 3 to 4 weeks that we'll be seeing this. In fact, there's a really good article. It's called The Hammer and the Dance. I sent that to you.
Yeah,
I don't know if you want to pull up that slide now. I can tell
yes.
people.
So Eric, can you, I feel so, I have a man behind the scenes who you saw earlier. Eric, can you pop up that graph for us?
Okay, now, so this, of course, with everything, there's, even with scientific literature, there's always criticism behind this, but this article is probably the best article that I have read thus far that really kind of predicts the future of what we're going to be seeing with the coronavirus probably for the next 18 months to 2 years. So the green line, the black line that says do nothing, that is, well, on that axis, you can see that's the number of corona cases, and on the horizontal axis, it's time. And this article, by the way, the source is on the right lower hand, Tomas Pinot, I think is how you say it. Anyway, the black line is if we did nothing, if we did not do any social distancing, that's how the cases would have spiked and increased. And obviously, you could see that that would have completely overwhelmed our healthcare system. And we would have seen a lot more deaths because we would have nowhere to put them in. And if you, read any of the cases and articles about the 1918 pandemic, that's pretty much what happened. They just ran out of capacity, and they didn't have, patients would go to the hospital and they didn't have a room, they didn't have a doctor to see you, they didn't even have a nurse. So if you were healthy enough to walk away and go back home, that's what you did. And if you weren't, you died on the streets. That's what we would have been seeing if we did nothing. And then the red line is mitigation. And that basically what that means, that's with just a little bit of social distancing. So we would have lessened that curve a little bit, but we still would have overwhelmed the healthcare system. And then this hammer portion is when the states shut down, when social distancing became, mandatory by the government. So that's the hammer. So they put down the hammer. They said businesses are closed. Everyone go home. We're social distancing. No one's allowed out. No one's allowed to gather. And that what it did is it really bought us time. It bought us time to prepare, time to buy supplies, time to train staff, time to learn from previous countries and what their experience had been. And then the dance refers to us opening back up and relaxing on social distancing. So as we do that, we're going to see some level of cases increase. And then what's likely going to happen is the government's going to say, okay, we're going to shut down these businesses and maybe go back to essential businesses. People need to stay home again. And then the levels of cases will decline. And then in 3 to 4 weeks, they'll go back up. So I think this, and this is where the dance, that's referred to the dance, coming back and forth and back and forth. And I think for businesses, it's important to know this and to read this article, because it does help you maybe to plan in terms of how many employees you may need, how many supplies you may need, how you're going to open back up. Of course, some of the criticism behind this article is it really didn't account for, if this virus mutates and what, is in store for that, but we don't really know. It's really kind of too soon to tell. So I do think for now, from what we know, this is the best way to predict the next 18 months to 2 years of what our new world is going to look like.
How do you, and this might be a hot topic, so you might not be able to answer in this forum, how do you convince people if they have to go back? So we released some of the, like for instance, my gym just opened back up.
Mm-hmm.
They're amazing, following protocol, only 10 people, it's all outside, it's in a parking lot, everything's measured out, no one's around. You see them, they're spraying down all the weights and things like that. The A+ job. I'm biased because I go there. I wouldn't go there if it wasn't. So how do you advise leaders to say, okay, now you've lessened it, people are coming in and pumping people, like, I've had enough, right? Like, I've done my 3 months.
Mm-hmm.
And sometimes you're saying, like, so, stuff saying like, I couldn't have my event, but then you allow this other event to happen. And there's a lot of, depending on who you are and what you faced, there's different types of severity, there's different types of opinions. So how do you advise governments to not only get compliance from their populace, but have them bought in? Because compliance is sometimes easy. I mean, if you really want to do it, you make a police state and military, you throw it in. It's a frightening way to go about it, but that's the hammer, right?
Right.
But how do you get people to, let's use your article, how do you get people to dance? Because dance, you need a willing,
right.
Forget that out. You need a willing partner.
Right.
So how do you get that and keep that morale there and the legitimacy, whatever word you want to use?
Well, I guess I would relate it back to how I have conversations with people when they're looking for advice, what to do with their family. People will text me or call me and say, what are you doing? And I tell them, if I'm talking about families right now, and then we'll get to government, but it's kind of similar, I think. So it's an individualized decision. I think what I tell the mothers and fathers who call me is, you as a family have to make that decision for your family, because there are risks and ramifications that we're going to be dealing with, and it needs to be an informed decision based on the health status of your family members. Obviously, family members who have elderly family members in the house, or immunocompromised family members in the house, or very young children are a little bit more precautious and are not getting out and doing this, relaxed kind of social distancing. However, I feel like my family's at really high risk because of what I do. I mean, there's the potential I could bring it home every day from my shift. So for us, I feel like my family's already at the highest risk and already, potentially exposed. So we are a little bit more light in our social distancing, a little bit more relaxed. And we have, luckily, healthy family members who think if they do contract the virus, they're probably going to be okay. And the reality is, our ultimate goal out of this whole pandemic is to get herd immunity. And that requires people getting exposed. We have to go back out. And I think, it's too early to tell right now, but I do think if you look at some of the countries, so from a governmental point of view, if you look at some of the countries that didn't do social distancing, they pretty much did, like Switzerland, and they pretty much decided that we're just going to let our people contract it. It has to happen. They went for kind of herd immunity right away. And yeah, they have higher mortality and morbidity rates right now, but who's to say that's not going to level off? Who's to say, they've been able to meet their capacity in terms of healthcare and so forth, but who says it's not going to level off and we're going to be about the same? Of course, you would expect if they didn't do any social distancing measures, you're going to expect a lot of people dying in the beginning. but they're also going to be contracting it and working towards herd immunity, which is key. The frightening thing for me is, I've been with my nonprofit organization, and I've been sending PPE to the nurses I know who got deployed to go help in New York City and New Jersey. And, when I look at the numbers, I was reviewing some of the numbers, and New York City and New Jersey were hit so hard, and I don't want to exclude all of New York. So all of New York and New Jersey was hit so hard and so quickly, and they've only been predicted right now to maybe have reached 20% of the population, nowhere near herd immunity, which is frightening, right? So the longer, in my opinion, the longer we stay home, the longer we social distance, the more we're kind of prolonging this dance, if you will, and prolonging the achievement of herd immunity. With that being said, I mean, the other idea in school of thought of prolonging this is prolong it long enough until we get a vaccine. Well, I mean, there's some speculations and some thoughts that we may get a vaccine by the end of the year or, 2021. However, that will be an amazing triumph in medicine if we can actually pull that off, because the soonest we've been able to create a vaccine historically has been 4 years. So I'm not sure I'm going to be signing up to get the first vaccine, So it's a difficult decision. And I mean, it's kind of nice that other governments and other countries have chosen to do different things, so we can kind of look at their numbers and compare and contrast. And I'm hoping that will provide us guidance for any future pandemics. So I kind of like the idea that people are doing different things, because it does give us some research later to look at.
So I have two final questions for you. One, very, very personal, and the other one, I want to hear all about your nonprofit. So the personal one is allergies versus COVID. And,
I know.
And so like right now I'm going to tell you something, and this is by personal, I mean, I've got a question. So I'm going to ask you, this is my show. I can do what I want. So,
yeah, absolutely.
So I have seasonal allergies. I have probably allergies I don't even know about, but like I've got guys, I was joking before, I've got my throat spray right here, which you can't see on camera. I've got my tissues. So I've got the eye issue, the itchiness. I got the throat. I'm sneezing. I've got the runny nose. Luckily, I've been able to contain it during this episode, but as soon as I'm going to be a mess, the second this is over, I'm going to be a mess. And, I've got like, and so every time I feel this way, normally I'm like, oh, it's just allergies, but what are like things I should watch at? Because, I'm assuming that, heck, there's a ton of people with seasonal allergies.
Sure.
What should I be on the lookout for besides standard allergy stuff that's more like, you might want to be a little more careful. You could have something more than just allergy.
Obviously fever. And I think if you develop, an inability to taste, I mean, we found that to be a high correlation for coronavirus. For example, I know someone here in Arizona who thought they had allergies, and so they just kind of were attributing the runny nose and congestion to allergies, and then one morning she couldn't taste. So then she got tested and was positive for corona. So that's been, a symptom that seems to be correlating well with corona. So obviously shortness of breath, any difficulty breathing, chest pain. If it transitions down into your chest, then I would be concerned. And if you develop a fever, I would be concerned. Another thing I would watch for is if you're taking allergy medicine and your symptoms aren't improving, then that would make me think that there might be another cause. But we have the same, high levels of allergens here in Arizona right now, and people's allergies are horrible. So people are coming in saying, is it just allergies, or do I have to worry more about this? And for me, I have a lot of allergies, and the N95, I'm allergic to N95 masks. Oh, so that's been horrible. But so we're seeing some of that with our nursing staff and our ED staff. So again, I advise them, when you get home, take some Benadryl. If symptoms improve, it probably is allergy related. But if you're doing all the allergy self-care that you can, and it's not improving, or you're having these other symptoms, then you do need to get evaluated.
All right. Well, thank you. So then the last time we have, tell us about your nonprofit.
Well, I started my nonprofit organization. It's called LIFE, which stands for Living in Fulfilled Enlightenment. And I started about 6 years ago. And my goal with the organization, it was actually built on the positive psychology philosophy of trying to support happiness and wellness. So Martin Seligman founded the School of Positive Psychology, and he found in his research that how you have sustained happiness and meaning in life is basically built on 3 pillars, which is mentorship, philanthropy, and community. So I built my organization on those 3 pillars. And my goal with the organization was to try to support my community, whether it was my parenting community, our school community, the healthcare community. I wanted to support them with education on various wellness topics so that they could function at their optimal level. And in doing that, we come together monthly for meetings at our house. And so then we get the community side of it. And then we do philanthropic events where we provide blessing bags for the homeless people. And we come together and we make it this big event with the kids and the families. And we put together, last year, we made 500 blessing bags full of toiletries, socks, things that we think the homeless people can use in shelters and so forth. And then we're working on mentorship. I have some young college students who are starting to open college chapters. And the goal has always been for me is to support whatever the community needs at that time and we could have different communities as well. So we want to start these college chapters, but also we're working with the healthcare professionals. And now with the pandemic, we couldn't run our monthly meetings. So I started focusing our efforts on our healthcare heroes because obviously it hits me personally, but I really felt like there's such a great need. So we started raising money for PPE and trying to supply the ED staff with extra masks, surgical caps, because again, you can get the fomites from the virus in your hair, which a lot of people weren't thinking of. We never had to think about these things before. So now we all wear surgical masks and we wear our facial masks and then, gowns and all this other equipment. So we've been providing that for the front line, which has been very exciting. And then also our community has been donating money so that we could provide food, because what happened was the cafeterias kind of closed down and weren't producing a lot of food, and then got to a point where they wouldn't let the nursing staff go down to the cafeteria in our scrubs because they were afraid it would transmit the virus. So then we started providing meals. And now I'm working on a very exciting new realm of this project is going to be our emotional support for frontline heroes. We're going to have a crisis team that will be available to provide emotional support. So if you're working a shift, you have a really bad day and you just need to talk to somebody, you can call them, on your way home and we're going to have a variety of people, some trained professionals who do life coaching. I have a critical care doctor who's going to be volunteering. I'll be volunteering. And then we actually have some college students, some nurses, and lay people. So, you could really choose, it can be anonymous and you can choose who you reach out to. But I think that there's going to be a greater need for this coming up. And I don't want to just focus on the front line. I want it to be available to anyone that needs some emotional support during this time.
Ah, so that's beyond tremendous. Thank you. How can we do you need any outside support? Listen, this is going to be recorded. We sprint it out to anything. Is there do you have a website or anything that if you're looking for I would say the easiest thing is donations and things like that. Is there something that
Yes, if you go to our website, livingenlightenment.life, which I think you shared a link to the website. Yeah. Thank you for doing that.
Of course.
You can look at our community pages. There's a video kind of explaining the purpose of the organization and our mission and values. And then we have community pages where you can donate time or you can donate money. And of course, the money will help to
Sure.
help me to help all these people, because the reality is, what are we going to do when our emotional, or when our healthcare heroes and frontline people have emotional trauma as a result of all this? If we can keep them supported, they can function at their optimal level and provide the amazing care that they do and continue to do that. So we really need to support them. And if you donate to our organization, we can continue to do this. We have some amazing events that we're trying to plan to support the heroes this year. And some of it will be, on Zoom, because we just won't be able to gather in person, but that's okay. I think they'll feel the support. And, I would tremendously encourage you. This is a call to action, to stand up for the people who have really impacted our world and saved many lives and put their own lives on the line for us.
Absolutely. We'll put it all we'll package it up. And when we,
Thank you.
oh, our pleasure.
An event is welcome to donate as well.
You have a line into Aventus besides me. That is definitely our plan. Now it's been recorded. I actually thought we did it already. So I can go,
have to follow up with your CFO guy there.
Yeah, I don't trust him. I know him too well. I know him too well. So funny. So now that actually leads me. I was questioning the last point. So now I'm going to ask it. How'd you meet Neil?
How did it meet?
How'd you meet Neil?
Well, it's funny. It's actually comical. So I was in medical school. I was in my second year of medical school, and one of my girlfriends went to college and she played golf in university, and so she was a big golfer, and she happened to be going to the Phoenix Open, which we always joke about because out here in Arizona, that's a big hookup place. And she said, "Hey, by the way, I have an extra ticket. You want to go?" It was on a Sunday, and she said, "You want to go to the Open with me?" And I said, "Sure." So I was supposed to meet them, and on my way driving there, she said, "My husband's going to bring his friend. I hope you don't mind." And that was Neil. And now they're actually godparents to our children. And the funny thing is, Neil went to high school with him and college. They were fraternity brothers, and I went to high school with her. But we were 5 years apart, and we went to the same high school, but just never knew each other.
Wow.
Until then, I know.
Does Neil actually golf?
Only a little bit, maybe once.
I thought, yeah, because we never talk about it. And
he's not very good at it.
Yeah, I'm horrible at it. I get that. I get the prize for the worst swing. I've had a couple of times, Caddyshack wise, the club actually flies out of my hand. So I'm actually afraid to golf now for other people. I'm not going to get with my own club, but someone is. It's not my sport. I have huge admiration for it. My dad plays. I try to play. Yeah, so it is.
Oh, then you guys will be perfect partners.
That'll be great. It depends on how much beer there is and who's driving the cart.
Yeah, that's true.
So Mara, thank you again. This means a lot to us. I cannot wait to distribute this out to people. It is huge message of hope, huge message of practicality first. So thank you for first being on, even more so for your service. You're on the front lines, not only doing the work yourself, but providing community structure with your nonprofit, leadership to everyone. It's a big deal. You're a huge linchpin in society. So thank you.
Thank you.
And here's hoping that for the rest of the nation and the world, the dance goes well. Mm-hmm. So with that, thank you everyone who's been on. Thank you for anyone who is watching afterwards. Don't forget to, if you have the wherewithal to donate time or money to Mara's nonprofit, please do so. You'll see all the information in the links we're about to put on. Not in this recording, but in the, because we're not good at video editing yet. We will be one day. I would have a sign posted up here because that's about as sophisticated as I get right now, but we're getting there. But you'll see in the email distributions and in the description of it. Thank you again, Mara. Thank you, audience. Have a great day, and hopefully all I have is allergies.
I hope so too. Thank you.
Take care, everybody. Bye.
Thanks.